All right. Hello. Welcome everyone to the Doctorpreneurs podcast. Once again, it's an exciting episode that we are going to have. And this is the first episode, actually, we are going to be on YouTube as well. Our first video recorded episode. Yeah. Previously, it's all been audio, and we were only on audio podcast platforms like Spotify, Apple Podcasts. But this time we are also going to be on YouTube, right? Thanks to technology, thanks to Zoom, we're able to do that. So thank you for staying with us. And once again, I'm Dr. Lim. I'm the host. And together with me is my co-host, Andrew Mastrandonis, all the way from America, but he's actually based in Malaysia right now. Andrew, you want to say hi?
Hello, it's great to be here. Thank you.
Yeah. And on our podcast today, it's a very privilege for us to have our special guest. And he is none other than Dr. Ian. Surgeons prefer to be called Mr., right, rather than Doctor. Maybe you can tell us a bit of a backstory on that. But Dr. Ian is it's with Hospital UKM, one of the university hospitals, and he is a general surgeon. He's going to be a liver or hepatobiliary liver surgeon soon. And I think your special interest is also in liver transplant, right? Because it's something that's so rare in Malaysia.
Hopefully. Yeah, hopefully.
Yeah, so thank you for joining us, Dr. Ian, and thank you for spending the time to join us on our show today.
Yeah, thanks for inviting me.
Yeah. So yeah, it's really exciting to be on a podcast with another podcaster, right? So Dr. Ian, you also have a podcast that's ongoing as well. It's called the Prescription Podcast. Do you want to just touch a bit on that podcast?
Right. Yeah. Finally, actually, I grew up more of an introvert. I don't know why I started this podcast. I guess basically, I think after years of being a doctor, and you constantly have to give information to people, whether it's your friends, your relatives, or of course just your patients. I thought it would be beneficial, and it wasn't very hard for us to start up this podcast. So we did this podcast with the intention of educating the general public about certain conditions. So for now, we've been doing a couple of diseases. Started off with the GI tract, the gastrointestinal tract, and now we've moved on to gynecology, and also latest few was on skin. Yeah.
So you actually have different specialists coming onto your podcast to talk about the conditions, or?
Yeah. So the first time around, it was between my co-host and me. My co-host is actually a gastroenterologist. So yeah, working in the same place, we had this discussion and talk about having this podcast, and we carried on with it. So I think for the first 17 episodes, it was just the both of us. And I think we decided to change it up because I think after a while, people might just get sick of listening to both our voices. So we got a couple of friends to come over from different specialties to just give some insight. Yeah.
Right. And I think it's still pretty new, right? People in the medical faculty in Malaysia doing podcasts. I think I know I'm one, and I know you are another one, but I don't know if a third other medical podcast there in the market. Are you aware of any others that are doing it?
Frankly speaking, I didn't search, didn't go look up. Right. Yeah, I mean, I've heard of a few overseas, but none in Malaysia. Yeah, so I don't know. I know yours and I know mine. That's all. That's about it.
Yeah, Andrew, I'm sure there are a lot more this kind of health and wellness medical podcasts in the US, from the US. Yeah, are there any ones that you find it particularly interesting that you want to share with us?
To be completely honest about it, I tend not to listen to medical podcasts in the US.
must be boring.
I tend to listen more to, business and entrepreneur podcasts because I'm a business guy as opposed to a doctor. So sorry, I can't help you there, but I'm sure there are dozens of good medical podcasts in the US. And frankly, even in Malaysia, BFM covers a lot of medical topics on their podcast.
Yeah,
they do.
Yeah. And Dr. Ian, have you been on BFM?
No,
not yet.
Okay, I've not achieved that kind of.
No worries, I'm going to hook you up. Yeah, because I know them pretty well.
Right. Wow. Okay,
yeah. Okay.
I think we're due to be back on BFM again, aren't we, Dr. Lim?
Yes, soon. Yeah, we're gonna go back soon as well. Yeah, so we're
nice.
gonna get you hooked up with BFM as well. So So yeah, I think you guys raised a very good point, right? Medical podcasts, when people hear about it, it tends to be like, oh, it's boring, it's technical, it's not enjoyable, right? It's like listening to business
Yeah.
podcasts, it gets a bit exciting, but when it comes to medical podcasts, it's like information and it can get a bit scary,
Yep.
a bit dreary. So Dr. Ian,
Yep.
how do you make your podcast interesting such that you can attract a wider audience? What are some of the key success factors that you have identified in the process of recording that many episodes? You've done more episodes than us, by the way.
Really? Okay.
Many more.
I don't know if it's considered as a success. My opinion of the medical podcast is, of course, trying to answer as many lay people's questions, right? Simple stuff that patients always ask me, like, oh, I have this condition, what can I eat, what can't I do? And of course, I try to be I guess, the class clown of the podcast. I try to crack the jokes, although sometimes it doesn't land quite as well. Maybe I need to watch a few more comedy shows and whatnot. But most of the time, just trying to keep it as simple as possible. And I think just trying to answer questions that people normally ask, right? I mean, I'm sure you have many friends or even relatives who ask you, if I have this condition, what should I not do, right? I think it's the whole Asian culture about, can I eat this? Is there something that I cannot eat? Does food cost this? I mean, those kind of stuff. So I try to make it, I try to produce the podcast in that kind of approach. Hopefully, it's helpful and it attracts people. But I don't know whether we are successful or not. That's a completely entirely different story.
Well, let me ask you a question about this. In the United States, doctors have to be very careful legally about giving medical advice. So how do you handle that here in Malaysia on your podcast?
That is a very good question. My co-host is very, very careful, especially so what we do is, I guess, initially, I spoke to Dr. Lim about doing podcasts, and he talked about how creating a podcast, it should be as spontaneous as possible. And I did bring this up with my co-host. She is a little bit more cautious in this manner. So what she normally does is, after we have recorded, she tries to screen through and see if there's any parts that needs to be removed, so as to not misinform the public. Yeah, so I was not quite agreeable at first because I wanted to keep it light and easy. But I guess that is an important aspect. We don't want to mislead the listeners.
Right, because the fact is, you could provide a lot of information about a particular illness or what have you. But if you don't really know the patient and their specific symptoms or medical history, that could be problematic, right?
Yep, definitely. So I think when we do talk about certain diseases, we do tell them that, these are common symptoms. It may not always present in this manner. I think what we always do is pretty much like a public service announcement, where we tell people, you have something that's worrying, and we do tell them kind of the red flag signs or symptoms that they should, seek help from a doctor. They need to see a doctor. A doctor needs to see them, as you said, as you've mentioned. People have different symptoms. So sometimes it's very important for someone to physically see them, examine them, and run the appropriate investigations. So I think the whole idea of the podcast was not really a one-stop solution. It was just to kind of more of information giving and helping people to understand a little bit better. At the same time, we are trying to encourage people to seek help early, right? I find that actually a lot of our patients, especially cancer patients, they come late because, and the most heartbreaking thing about most of these patients are when you tell them they have like stage 4 cancer, and they ask, how come? I never had any pain. I never had X symptom or Y symptom. And, often we tell them that, it doesn't present that way. So doing this podcast hopefully gives people a certain idea, tells them when to screen early for certain conditions and seek help early. Yep.
Yeah, I think circling back to your statement on you're not sure whether you are successful or not, I think by getting started, it's half the success. So you're definitely half successful at the very
All right.
And
Great.
yeah, and it's actually very encouraging because to see that you guys are really have doing it with a mission and similar to us, it's more like getting information out there. It's more like educating the public and whatnot. And the question is like, for example, because there are sometimes there can be quite many school of thoughts when it comes to treatment procedures or diagnostics or thinking about certain diseases, right? How do you guys ensure that you guys don't inject your biases, or is that something that you do a disclaimer of, or is it okay to express your opinion, or are you guys more like fact based and make sure that their biases are not involved and all these things?
I don't know if we can completely avoid bias. Having said that, when we do discuss, we try as much as possible to follow whatever protocols that are out there, published protocols. It's are all some things we, before even we meet with our guests, our specialists, we do read up just to make sure we have a rough idea. I mean, for instance, the last few episodes, it was all about skin. And I kid you not, I know almost next to nothing about skin conditions. So we have to read up to get a rough idea, and we explain. And I guess what we try to do is just put up questions to even our guests to help answer some of the questions that future patients might have. But having said that, of course, we may miss some things. We are human after all. I'm hoping, and as I said, we do try to vet through the podcast after that to make sure that we've not missed out anything. There were, I think, 1 or 2 episodes where we put on additional information in the bottom of the podcast to direct people to the correct website to get more information. Yeah. So hopefully, in that case, that we have provided as accurate as possible information with the least amount of bias.
How do you decide what topics you're going to cover on your podcast?
When we started, because I'm essentially a general surgeon and my co-host is a gastroenterologist, we covered all the so-called common topics and in what we think were important topics. Of course, there are some biasness there because, as for me, I would always say, liver cancer is important and whatnot. So we kind of discussed through before we started the podcast of the first few episodes, and then subsequently from time to time we have this discussion. Just today we had a discussion, what are the next few episodes going to be. So we will try to, well, at least I tried to clump them in a so-called system. The first so-called season was the GI tract. I wanted to do women and health, but after a while I realized we did not have that many topics. I think we stopped at about number 5. Then we're doing a so-called skin series, which will be about another 4 or 5 episodes. Then we probably go into something like cardiovascular, the heart, and the brain as well. So that one probably will be a very large area. So basically by team as much as possible.
Yeah, I personally think that all medical schools in Malaysia should make listening to your podcast as part of the curriculum. Because it's like things sometimes in medical school, it's like the information are not exactly updated. But with you guys, releasing new episodes and new information you guys do it on a weekly basis, right?
Fortnightly.
Fortnightly, very consistent. I know you guys have been very consistent, and I think that would also help in the medical education, and you guys are teaching hospital as well. I think that would be really good.
I actually have a friend I actually have a friend who's a medical student. I think it's his 3rd year. He's in his clinical year, and he says like, man, listening to some of your podcasts saves me some studying time. I don't know how accurate that is, and I'm worried sometimes that we go a little bit too deep, and how are they going to quote? If they have a discussion in the lecture, hey, I heard that it's supposed to. Where's your source of information? Oh, podcast. I don't know if that's going to be accepted or not. But hopefully this is educational to medical students as well. That would be great.
I think it's definitely a good alternative source of information. I mean, nowadays, I even barely listen to the radio anymore. Most of the time, whenever I'm in my car, I put on podcasts. Whether it's from whatever area of interest that I felt like, on that day, it could be medical, it could be entrepreneurship, and that's why Andrew and I, we decided to get together and say, you know what, let's do a medical and health and entrepreneurship podcast. That's why our tagline is the intersection of health, aging, and aging is our business, right? We're in the aging business and entrepreneurship, right? So that's why we call it the Doctorpreneurs podcast. I think it is becoming mainstream as a reliable source of information. It's definitely more reliable than Wikipedia, if you ask me, especially if it's coming from qualified professionals like us, in the process. I think, it could be a reliable source. So just to deviate a bit, right? And we know that you are a surgeon, right? And you're also, besides doing the podcast, you're also actively practicing as a surgeon in a hospital. You're also a lecturer, if I'm not mistaken, right? In a teaching hospital as well. So maybe can you tell us a little bit more about like your passion and how did you end up in medical school? How did you end up in becoming a surgeon? And now, and how did you decided that liver transplant is your thing and going into, education and all, maybe tell us a little bit about your journey in getting to where you are today.
Yeah. My story, I think, like pretty much everyone, is probably a little bit, I don't know, mine, I feel mine is a little bit funny. I've just been recently asked this question a couple of times over by different people. Why did you choose to be a doctor? I think most Asian kids who grew up in the 80s or the 90s probably had the same answer. I give credit to my parents, but I think when I was younger, my parents only told, like most Asian parents, said your choices of occupation in the future would be, I think you would know, engineer,
doctor, lawyer, engineer,
accountant, lawyer, doctor. So I looked through, I looked through my options and like, doctor seems interesting. The white coat looks good. Let's go for that.
Right.
That was the beginning.
I appreciate that you're being very honest with this, right? Because some people will say, I want to save lives, all these are all nonsense answers.
Yeah, that's what I answered in my interview to get into medical school. I want to make a difference, I want to save lives. Yeah.
Not to stereotype, but most of my Asian friends in America tend to be in those professions.
It's really like that, right? I mean, the Asians, whether they want to admit to that or not, but it really is. I don't know now. I'm not sure. But back in my day, it really is. I mean, look at most of my classmates. Most of them are in this 5 occupations that I've just mentioned earlier on. So
Andrew, we like the hard stuff, Andrew. We don't like social science and all this nonsense. We like the hard stuff.
See, I think American parents are a little more honest. I think they looked at me and said, "You're probably not smart enough to be a doctor or an engineer." So I studied economics.
I don't know if Asian parents give you the chance. There are these jokes. I don't know if you've ever heard. You go to your parent and you go like, "Hey, Dad, I got 98 out of 100, 98%." Parent, you're expecting them to give you a pat on the back. You go like, "What? 98? John down the road got 99. What happened to you?" It's probably accurate for most of the Asian families, at least in Malaysia and back in my day. So,
Mom and Dad, I still love you if you're watching this.
I love them. I do.
My parents are happy if we could break 70%. So.
Yeah. So I'm trying to not do that approach. Hopefully, things turn out well, my kids. But I entered medical school. But entering medical school, the love kind of grew, especially when I went to clinical school. My clinical school was in Canada. It was a very eye-opening experience, but I really enjoyed everything, from the interaction to, I think medicine is pretty much another one of the many occupations that's really problem solving. And after a while, things can kind of be the same problem, but every once in a while you have a challenging problem. And why surgery? I think when I was younger, with all the shows that you watch, ER, you see the surgeons flying in and out, they're saving lives. It looked really, really cool. But when I had an opportunity to really go into the operation theater, or operating room, and seeing the patient before and after, really made me go, wow, such a huge difference, the things that can be done with the surgery. And of course, within surgery itself, there are so many branches, right? Why not like orthopedic or ENT and so on and so forth? I don't know why. I even had an argument once with someone who wanted to be a neurosurgeon, and at that point of time, I didn't have a witty comeback. You're like, why do you want to mess around with the bowels, And look at me, I'm going to be a neurosurgeon. You don't have your brain, you can't live. And I'm like, yeah, I was like, but if you can't, poop, you're going to have problems as well, right? So that's the best I could come up with. So even with the many obstacles along the way, and many people tell me, like, you're choosing general surgery, are you sure it's a hard lifestyle? I did some of my electives in America, in the US, and some of my friends were there, like, you sure this is like hardcore stuff? You got to wake up early, you got to go back late, you got to work through like almost 7 days a week. It's going to be like that. It's tough, blah, 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 blah. I'm like, no, this is what I want to do. So, yep, long story short, after 15 years, medical school through master's, I became a surgeon. Yeah.
Interesting. I never knew you trained in North America, right?
Yeah. I was there for 2 years in Canada. Yeah, did a 2-month stint in Indianapolis.
Okay. And right, very interesting journey, and I thank you for sharing your thoughts and your experience throughout this. I think this is also going to be helpful for some of our budding junior colleagues when making a decision. Sometimes I think you just got to go with your heart. Like for me, I knew I wasn't really clinical material, so at a very early stage, I decided entrepreneurship is more for me. So so I've decided to be a entrepreneur instead. Yeah.
And I'm very glad you did that.
Yeah, I think you're doing a good job, man.
Yeah, I think that's where I excel in my field as well. But like that being said, right, your experience being in North America, in Canada and in US, it's actually two totally different healthcare systems. One is more socialized, and the US obviously is more of the capitalist kind of healthcare system. Can you share with us a little bit about how what differences that you have observed comparing the Malaysian system to the Canadian system, maybe a little bit on the US system, and maybe Andrew, you can further expand on the US system as well when it comes to healthcare.
Okay, so maybe I start with the Canadian system first. Like you said, I guess it is somewhat a socialist system. Healthcare is free actually in Canada, except for medication, which you do need to have health insurance for that. It is pretty good because anything at all, small surgery, big surgery, admission, a visit to the family doctor, it's covered. But if you do need medication, that needs to be paid for, either out of your own pocket, or if I think they have insurance, which I didn't really ask at that point of time. In the US, I suppose you need pretty much insurance for everything, from healthcare to medication. I won't touch too much on that because I was only there for 2 months. But I do know that one thing that really scared me while I was in the States was I was watching TV, and I will always remember there was an advertisement out there by a lawyer saying, if you were wrong by your doctor, or if you were given the wrong medication, please come and see us. I'm like, oh man. But I think having said that, US has really fantastic doctors. They're really good at their subspecialty. I think they're really good to ensure that everything is done well for their patients. Okay, so now Malaysia. Malaysia's healthcare, what would you describe it to be? It is one of the, or maybe the most affordable healthcare in the world. Having pay minimal amount to see a doctor, whether it's a regular clinic visit or if it's hospitalization. I still remember one of the pictures that was shared, I think, on social media about a man having to pay his hospital bill after his mom was in the intensive care unit for, I think, about 2 or 3 months. He was expecting tens of thousands of ringgit. But when he went to the counter, he paid, I think he only paid in excess of about 100 ringgit plus. So healthcare is cheap. Is it great? I guess it's suffice for now. What we lack in, I feel, is subspecialty. We are not as subspecialized as the States. I will give an example. So one of my juniors from medical school, he is, what was the term for it? Okay, he was studying a subspecialty branch of cardiology, right? So cardiology is basically the physician that looks at the heart. He looks specifically only at electrical activity of the heart, nothing else. He doesn't do any angioplasty. He doesn't treat, valvular disease or those kind of stuff. He only looks at electrocardiograms, and if there is some sort of disturbance within the electrical activity, he acts on that. He treats that. So it's a very, very sub-specialized branch of cardiology. Whereas in Malaysia, our subspecialty of cardiology is probably just mass interventional, which covers everything. So yeah, so that's one of the big differences I would see. I think Canada probably has the same as well. They're probably quite subspecialized. Maybe not as subspecialized as the States, but definitely more so than in Malaysia.
So are you saying there are a lot of subspecialties that we wouldn't find here? For example, I had an ear disease many years ago called cholesteatoma, and I had to have 4 surgeries, twice on each ear. I went to the New York Ear and Eye Hospital in Manhattan, top notch, a great doctor, successful. Would I find that kind of, microsurgery in my ears here in Malaysia?
I'm not sure about that. I'll have to ask, but
I think
not sure.
Yeah, I think maybe even if there's someone that can do it, it's only very handful. I think it's
probably 1 or 2.
Maybe 1 or 2, and probably you have a better chance in finding more subspecialists like that in Singapore. So probably some of these cases will be treated in Singapore instead of in Malaysia. So yeah, I think that's considered a pretty rare condition, right? In Malaysia.
Cholesteatoma?
Yeah, cholesteatoma.
I have no idea.
Yeah, I haven't heard of it much around Malaysia in our practice.
Well, so. I think basically something eats in the structure of your inner ear, and they have to go in and repair it essentially.
Right. Yeah. So actually, I think in Malaysia, when it comes to the private, well, just now you mentioned the story of the man just having to pay 100 ringgit for 2 or 3 months of ICU stay.
That's government.
Yeah, I think it's important to clarify that's in the government. Government, and that's only for Malaysian citizens. So if it's a foreigner like Andrew, you're gonna get services here in Malaysia. You probably need your insurance, and it really doesn't really make much of a difference if you go to the government sector or the private sector, because you have to pay. The insurance will pay for it anyway, because you have to pay for medical services if you go to the government service in Malaysia. And I think the private sector in Malaysia will be more similar to the American system, whereby everything has to be insurance. If you pay out of pocket, it's actually quite costly. Like recently, I had an aunt that God rest her soul, just recently passed away, but she actually went to a private hospital for spine surgery. It was a pretty basic surgery, and she was there in the hospital for maybe a little more than a week, but it cost us about close to 100,000, little more than 100,000 ringgit for the entire stay in a private hospital, because she didn't have health insurance. So we also have this kind of similar issues, whereby if you go to the government side, so she actually went to the government side first, but the government side said that there was a list, there was a queue, and they couldn't operate on her as soon as possible. And we wanted to, like, although we know that her chances of recovery were not high, we didn't want to delay it any further. That's why, we decided to transfer her to a private hospital to get the surgery done as soon as possible. But then, there's a cost that is attached to it as well.
But isn't this often a problem you find in Malaysia with socialized medicine, in Canada, maybe the UK, that you can get things done cheaply or not pay at all, but you may have to wait?
Yep, that is an ongoing issue. I'm not sure about you. I guess it should be the same because the systems are similar. It depends from hospital to hospital, and it depends on the type of disease. So I'm not saying the practice that goes on in my hospital is the same as the rest of the country. But for us, cancers, which you probably might think that it's still a bit slow, but we do try to get them operated within a month. Yeah, but of course, if it's always best to operate as soon as possible. So some people will say within days, right?
Yeah, that's a month. That's from diagnosing the cancer to the surgery. That's a month, right? Yeah. So that means you already got the histopathology, you already got the cell type report, you already got the scans, all the diagnostics all done, and that to surgery is a month. But getting to the diagnostics part, getting the scans done, getting the pathology side done, that could also take some more time as well in the public sector.
Yeah, so again, depending on which hospital, in my place of practice is a little bit faster.
Okay. Yeah, but I think generally the sentiment is, you're right, Andrew, that pretty much because healthcare is given out freely in Malaysian citizens, they are more often than not we have to ration the resources we have and to really learn how to prioritize. Sometimes sometimes like with the COVID situation and everything, it's like sometimes doctors even have to play God to decide who lives and who dies, because not everybody is going to get a ventilator, for example. And I think this is for me, I think this is one of the toughest things a doctor has to go through to like really have the mental aptitude to decide, who lives and who dies. And I think that's just crazy. I can't handle it, so I'm out of the hospital system. Yeah.
Well, I didn't have to handle that, so thankfully.
Yeah. But speaking of COVID, you guys did not speak about COVID on your podcast. I don't remember hearing any episodes on that.
I did. That was the least heard one, because we had this debate about trying to do it early and whatnot. She's like, nah, I think everyone else is giving a talk on COVID, so she's like, let's not do that. But we did do one in the end, because I don't know if you know this, but I was infected with COVID.
I didn't know this. Oh my God.
Yeah.
I'm finding it now.
I was infected with COVID, and we missed out one of the episodes, one of the weeks. So we did kind of a retrospective kind of talk on COVID and my experience with COVID, and just put it there. But I think that was one of the least heard. I think everyone was sick of listening about COVID by then, so nobody listened to it.
No, we are definitely going to circle back to your whole COVID experience, but let's just finish our thoughts on the healthcare system. And as I understand that you are going to Taiwan to basically subspecialize in your liver surgery to basically get yourself fully certified. Why Taiwan? I mean, Taiwan, I know we've heard about Taiwan as also a very good healthcare system in the East, right? But like, why did you choose Taiwan? Why is that your destination as compared to, Western countries or whatnot?
Okay. Well, I think number one, given prior experience in the Western country already, I would like to see something different in the Eastern country. That's one of my personal reasons. But I think more than that, liver cancers, hepatocellular carcinoma is quite big within this Eastern side. China, Hong Kong, Taiwan. There is, I think, to some extent, Japan and Korea as well, but definitely in Taiwan, Hong Kong, and China. So, given these few countries, and of course, having known someone from that particular country, it's a little bit easier to get yourself attached to. And the guy that I want to work with is one of the experts in so-called the field that I want to go to, right? He does a lot of laparoscopic liver surgery. very efficiently. He's featured in many conferences and whatnot, right? So I managed to meet up with him. I've seen how he's worked. So I really wanted to learn from him, given that he covers actually not just liver, but he does pancreas as well. Laparoscopically, and he does liver transplant. So I kind of learn everything all in one go, although my goal is pretty much on liver. And of course, language is also an issue. I think you should know I am what people call a banana. Yellow on the outside, white on the inside. My Chinese isn't very good. So Hong Kong wouldn't actually be a bad place to go to, but felt it was a bit unstable. So I did not want to go there. China would actually be not bad at an option because their numbers of cases are really, really high. You get experience by sheer
Volume.
the volume, right? But I really can't. I think it will be like chicken and duck talking in China. At least in Taiwan, I can understand the accent a little bit better, and they can speak some English, so it's a little bit better there. And yeah, those are the few reasons why I chose Taiwan.
Yeah, when you say Hong Kong is a bit unstable, you're talking about the whole political situation there and the unrest and all.
Yeah.
Okay. All right. And just to clarify, like when you mentioned laparoscopic surgery, for those that are not from technical backgrounds, right, that means keyhole surgery, whereby you don't slice open the entire abdomen, you just dig a few holes and just put in probes to operate on that. And that is basically what you want to advance in, right?
Yeah, that because sometimes when we remove the chunks of the liver, it's definitely easier to just open the patient up big. But doing keyhole surgery basically helps the patient in terms of recovery, less pain,
minimally invasive, right?
Correct. And of course, if you have to go back in for a second time, it's actually more favorable when they have minimally invasive surgery for the first time, right? There is not so much scarring, adhesions. I think, as you know, it makes the surgery easier. So I would really like to bring that back. And of course, Malaysia does have a bit of liver transplant. It's just that it's not great. It's trying to pick up. Hopefully, I will be able to contribute in that direction as well in the future.
Yeah. When you say not great, what are we talking about? Is it the skills that we are not so highly skilled, or we don't have that many cases, or we don't have that many donors, or how's the situation like when it comes to liver transplant in Malaysia?
Multifactorial. We do have the skill sets, although it's not that many. There's only a select few that does it. At this point of time, it is Selayang Hospital for Ministry of Health, and University Hospital would be University Malaya. There are two types of basically organ donation. So cadaveric, which is basically from a dead person, or we have living donor. Essentially, previously we were doing mostly cadaveric, right? But I think unfortunately, not many people donate their organs even after death, right? And Malaysia is such that even if you do pledge as an organ donor, family still gets the final say to not remove the organs when the patient has passed on. So that happens. I think even a lot of people, they have signed up to donate their organs. It doesn't happen at the end of the day. So when there's organ shortage, then of course the recipients are not going to get those organs. What University Malaya did is to start living related donor transplant, which means one of the relatives who is blood compatible are able to give a part of their liver for the recipient. So I think they're doing it quite regularly now. From what I understand, it's almost every month. Yeah. So I'm hoping that I've acquired some of these skill sets and learning a little bit more about liver transplant. I would able to contribute in that direction as well.
Very interesting. And it's certainly very different situation, I think, in Malaysia, whereby we can actually pledge to, I'm a pledged organ donor, but my will gets to be overridden by my family who is left behind, apparently. So that's, I think, but in US it's different, right, Andrew? If you pledge to be an organ donor, basically that's it, right?
Yeah, I don't get the point. If you want to be an organ donor, what's the point if somebody can override it?
I think I really can't answer that. I think
It serves
policy.
as a point. It serves as a point of reference at all. Okay, he has expressed an interest to donate his organs, but final decision makers are still up to the family members that are left behind. But like, okay, I know we've gone now a bit of a rabbit hole in terms of liver transplant, but I just want to go back a bit to the whole healthcare system thing again. Like, in your opinion, right, Andrew and Ian, you have been exposed to both sides, and Andrew, of course, now that you are also learning about the system in the East and all. What do you guys think is the better way of doing healthcare, right? On a policy level, whether is it better like how the US does it in Canada, or how the US does it, or how Canada does it, or how we do it in Malaysia? What do you guys think is the best way of doing healthcare?
Well, personally, I don't really like the U.S. system in the sense that the way it works is that to get health insurance, you basically get it through your employer. So when you quit your job, move to another job, you get health insurance with the new company. Or you have to self-insure if you're an entrepreneur. Or if you don't have a job, you have to find health insurance somewhere. And unless you get on this quote Obamacare system, it can be very expensive. And even parts of Obamacare are very expensive, depending on where in the country you live. So I tend to favor a system where everybody has a shot at inexpensive or no cost health insurance.
Yeah, but then wouldn't but then I think, like what Dr. Ian mentioned just now, like the doctors in US are so highly skilled, highly advanced, because maybe partially they are really incentivized by the financial incentives of really becoming good at their crafts, as compared to in Malaysia, we kind of just want to do everything in the general sense.
Yeah, I understand that, but in the US, if you don't have a good job with a good employer that has a good health insurance policy, you're likely not to get access to those doctors. So that's a bit of a problem for me.
Yeah, Dr. Ian, you have any thoughts on this?
I think that's a really tough question because there's no perfect system as of yet. There are good aspects to every healthcare system that I think we can adopt from. The good thing about, healthcare, it's very hard to self-sustain if there is no money, right? You do need money to get new equipment. You need money to train doctors, not just incentivize. I've spoken to a lot of doctors in Malaysia, and a lot of times many leave the government not because of more money, it's for other reasons, which I will not state here. But one of the reasons why they leave is they cannot, do certain things, or they cannot carry out certain due to lack of finances, right? And
I will say the reasons are mostly politics, red tapes, backstabbing, all this. I know you don't have to agree with me, Ian, but yeah, it's a lot of this going on in the socialized healthcare system as well.
So I think there are some merits to having some charges. It's just that where do you draw the line? It's very difficult, right? Who do you want to please? Do you want to please the patients? Do you want to please the doctors? Do you want to please the administrators, the politicians? Where is the middle point? It's very difficult to point out. So yeah, I don't know. I'm not in the level of administration, so it's very hard for me to say. I may be looking at it at a healthcare personal point of view, right? So it's very easy for me to say that administrators not doing their job. But I think one of my bosses recently became the director of the hospital, and every once in a while he shares reasons why certain things are not being funded. And when I hear it, and then I realize that I do not see those sides, right? I only see what I want to see. So yeah, I don't know. I probably need to be exposed a little bit more to the administration and maybe learn a little bit more about how healthcare is supposed to be done. At this point of time, I do what I can do, I suppose.
Yeah. It is pretty tough. Like you said, there's no perfect system, but to play devil's advocate, right? I'm don't get me wrong, I'm very thankful that in Malaysia we have a healthcare system that is very affordable. Primary care is still pretty affordable. Government hospitals, basically everything is pretty much free for me as a Malaysian. I'm very thankful for that. But the only problem I have with this system is how do we get people to develop awareness and get educated such that they don't think that, okay, I can just abuse my body throughout my entire life and then depend on the government to take care of me when it comes to the end. So I think there is certain level of education that also needs to come in hand in hand as well with this system, so that people don't just view healthcare as a entitlement, which I know many people do it now. I'll get my drugs free, and I just don't, even if I don't finish the medication, I just toss it out because the government gives it to me anyway, and resulting in a lot of wastage, leakage, corruption, all this that are happening as a result of the whole socialized system, and people that are, Malaysians that are supposed to benefit from the system, more often than not, not to say more often than not, I say very often would abuse the system, which I find it very unpalatable coming from, maybe because I'm also an entrepreneur coming from a business background as well. I do find that these things it's a bit sad to look at all this,
Yeah. I don't know, man. Honestly speaking, I know many people who can afford their own medication, who can afford to go to private, would still queue up an hour in a government clinic because they say, hey, I paid taxes. Why not? Why not take full advantage of it? But the fact is, there are other people who need it more. But this is the thing, you can't control, and these people are, sometimes actually very well educated as well. So is it really education? I don't know. Just some things you can't control, I suppose.
I think it's human nature that if you can get something for free that you might have to pay money for, you would try it potentially.
Yeah.
So civic mindedness, I think, is something, it's not just, I don't think it's just a purely healthcare issue. I think education comes hand in hand as well. And I think these two will have to grow together if we are going to develop a generation of Malaysians that are going to appreciate the system, not abuse it, and at the same time for the system to be able to sustain us, because as you mentioned, money has to come from somewhere, right? So these are taxpayer dollars that are going to the healthcare system that could very well go into other things, right? Development and all these other things, but we all have to subsidize the healthcare of people.
I do think that one way to get people to be more careful about how they use healthcare resources, particularly if they're free, it starts from the top, whether it's Malaysia, the United States. It starts with the politicians who tend to be corrupt and sort of lead the way when it comes to these things.
Yeah. Unsurprisingly, like what you mentioned just now, if it's free, then people will, try to fully utilize it, right? To mildly put it. Right. Yeah, I think this is going to be an ongoing discussion, which healthcare system is most viable, and we're going to have to just see how it unfolds as we go along, because we know that many populations are now aging. Aging is our business, so we are seeing populations that are aging. Essentially, whether it's social security in the US or taxpayer EPF in Malaysia, or all this funds that the government has for us, budget that we have for our healthcare, is essentially like a big money game, right? It's a pyramid scheme. So the old people that has contributed now gets to enjoy, and then the new generation that are coming up, now we are contributing into the coffer to pay for all these retirees and so on and so forth. But with the demographic shifting towards aging population, that means there are less and less younger generation contributing to the coffers of the healthcare, to subsidize the healthcare of these old people. So we don't know. Maybe the system will collapse some way, sometime and somehow. Only time will tell whether which system is the most sustainable and most viable and can also deliver the best quality of healthcare.
But let me ask you though, even though you may contribute money through your taxes as a younger person here, it's my sense that money going to the elderly, we call it Social Security in the US, isn't all that much here, or can cover a lot of people, right?
No, I don't think so. I think because in Malaysia, we don't contribute our taxes specifically to any funds when it comes to subsidizing the healthcare. It all goes into the government budget. Yeah. And we don't know sometimes what the politicians do with the budget. We don't know. I'm not going to speculate. But if things are ran efficiently, we should be able to sustain a healthcare system in Malaysia, because it's only about 5% or 5 or 6% of our total healthcare budget. That is if provided things are done efficiently, effectively, free of corruption, with integrity, which I think these are also, so there's the healthcare, there's the education, and also the policy part that needs to be tightened up to make sure that, things are not misused or wasted, or abused, right, to simply put it. Yeah, so I think there are still many elements in fine-tuning the Malaysian healthcare system.
Yeah, it really kind of scares me when politicians get a large chunk of money and then they get to decide what to do with it.
Yeah, it makes me nervous as well. But yeah, that's why I think many people are motivated to go into politics because of the power and monetary rewards that comes along with it, which I think it's a topic for maybe another day. Now, we are coming up to the top of the hour. I really want to delve into your experience with COVID, and because there are so much speculations that are flying out there. There are people that are saying Omicron is good news because the pandemic is coming to an end. Omicron is bad news because it's going to infect more people, gonna kill more people in the process and everything else. But okay, we have a lot of information and data out there, but it's nothing like listening to someone's personal account when that has gone through the ordeal themselves, and they can kind of tell their own experience, even though it may just serve as anecdotal data, right? Only one what do you call that? One data point, right? One person's experience, but it's still good to hear from someone that we know and we trust, that won't exaggerate or won't lie to us or won't make up data because of their own for their own benefits, right? So Dr. Ian, maybe you want to share with us when did this happen, and how do you handle the whole thing? Especially you have kids at home, you have 3 children, and how do you handle the whole situation having COVID and where do you think you got it from? The whole COVID issue that you've gone through.
So this was back in August. Yeah, August. I think just around Merdeka.
Okay.
During 31st, somewhere around then. I remember coming back one Friday evening feeling particularly strange, like just not my usual self. I think for the past year and a half, I've been pretty well because I think everyone's not been going out, everyone's been wearing masks, right? So I've not had one time where I was ill, but that day just felt very, very strange. Came home. I already told my wife, I'm not feeling quite right. Let's not eat together. Let's not, come close.
Basically starting the quarantine process. Starting to quarantine yourself.
Sort of.
Yeah.
Sort of. When I put my kids to sleep, I told them no hugs, no kiss tonight. When they went to bed, I did the rapid test kit and 2 lines came out. Then I'm like, oh, man. At that point of time, there's a lot of questions. Where did I get it? To be honest, I really don't know. Wasn't seeing patients that week because we were taking turns due to the whole COVID process. I did have a meeting full of people, a full room of people, to which they did do the COVID test and none of them had it. So after I limited all my sources, I still don't know where I got it from, but that's beside the point. So I think then began the whole isolation process. My wife was, discussing with me to see whether I should stay at home in the room or whether I should find some place to isolate, like a COVID hotel, right? And if you know me, or if anyone knows me, I can be quite the miser. I started calculating dollars and cents, like how much I need to spend, if it's 10 days in hotel, blah, blah, blah.
Yeah, the government really should be paying our doctors better, Andrew. They're not paying our specialists enough, definitely. Yeah, go ahead. Sorry to interrupt.
So I was calculating and I said, let me slip it off tonight and we'll see how tomorrow morning. So I start in a separate room. The next day, the fever started, the whole body ache started. It was pretty bad. I already had bought the S02 meter, the oxygen saturation meter, to check previously. Someone gave it to me. So I did my checks a few times during the day. They were still good, right up to about 4+ in the evening. At that point of time, I kept eating, even though I didn't have very much appetite, but just really didn't feel great despite the paracetamols that I've been taking.
Did you lose your sense of taste and smell?
I'll get to that.
Okay. All right.
Not yet at that point of time. So I checked my oxygen. It dropped. It went to 94.
Oh dear.
Wow.
So I was like, Yeah. So I was like, maybe it's just because I've, just woken up from my nap. Let me do, a few deep breathing exercises and I'll recheck. Still at 94. So all sorts of things went through my mind because the process, right? What can happen, where it can lead up to, right?
Mm-hmm.
So I called my friend in the hospital and said, hey, this is what's happening. My oxygen level is this. What should I do? Should I be admitted to hospital? It's like, yeah, okay, fine. We'll book you a room. You can come. So after I did all of that, I checked the oxygen level again. It was 89.
Oh,
So I was like, yeah, I was like, oh man, this is, at that point of time, I think I was getting a little bit frantic because I mean, you see all these patients, you know what to do, but now it's yourself. And not just thinking about yourself, you're thinking about your family, right? You're thinking about what's going to happen, what's going to happen to my wife. So I started writing down all my bank passwords, my pins, and whatever not. I told her, the email is this, pins are this, blah, 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 blah. It's all here. Okay. So didn't want to call an ambulance because they're not going to send you all the way. And again, I know dollars and cents, it's going to be expensive if I hire a private ambulance.
for 600 over 600, 700 ringgit per trip.
Yeah.
Yeah, nowadays.
Yeah. So me being me, I drove to the hospital.
With oxygen saturation of 89%.
Yeah.
Wow, brother.
Yeah, I know. In hindsight, that was not a wise idea. But anyway, reached hospital, checked my SpO2 there. It was on the dot 95. So I was like, man, is it the machine or is it really me? I don't know. But to be honest, the next few days until my fever broke, every time they checked my oxygen, it was always at 94, 95.
Okay.
Right. When I finally broke the fever, it went back up to 98. So there
Which
was
is your usual.
some form of element. Yeah. So by the third day, which was the second day I was in hospital, I woke up in the morning, I ate my breakfast, and I know hospital food is bad, but I didn't expect it to be this bad, this bland, right? And I just continued eating. Then I popped the sweet in my mouth, and there was no taste. Then I started sniffing things, and okay, I've lost my taste and smell. Yeah. So those few days was just pure rest. Every time they came and checked my oxygen, I would worry. But when it finally picked up, as I said, my fever had broke by then. I mean, it was completely normal, no more ache, nothing, just no taste, no smell. So I think that was day 5 of my sickness. Then I asked, so can I go home and isolate? Or my wife's like, if you don't want to pay for a hotel, you might as well just stay in hospital. But I really couldn't, despite having my own room. It wasn't very comfortable, and I was, I think, probably going a little bit nuts at that point of time, looking at the wall, looking at the clock, trying to look outside through the tinted window.
Yeah, no free Wi-Fi in government hospitals. Place.
No, there is in my hospital.
Okay.
I mean, there is. Well, I mean, for staff at least,
Okay.
It's I work there, right? Yeah, but I just couldn't. I couldn't put myself to keep watching on my laptop and whatnot. And people were very nice. People sent me stuff, sent me books, but I just couldn't. So I decided to check myself out into a COVID hotel, and had a very good, solid 5-day rest after that, and came back refreshed. The only thing that stayed with me for about a month plus was the no taste and no smell.
Oh, that really sucks, man.
Yeah. Well, to a certain extent, because I have a very sensitive nose. I don't know if you know that.
I know that, yes.
I sniff scents, perfumes, smoke. It triggers, right? I start sneezing. So for the first time, that didn't happen because I can't smell anything, right? So I don't know why. Yeah. And I subsequently, I think up till now, I have actually a bit of reduced smell sense. So I live in an apartment. Sometimes people smoke. I used to be the first one to detect it. Now my wife tells me someone's smoking, close the window. So I don't smell anything. So I think there is still some residue, but yeah, otherwise I'm fine.
Yeah. I think you're not the first person saying that there's the sense of smell and taste doesn't really come back 100%. Some one of my colleague, Dr. Tan in Penang, she also suffered from the same symptoms, and Angela, which is one of our team members, also. They said it's not 100%. They don't get it back 100%, even after a few months. So yeah, I hope things it's gonna turn out for the better for you, man.
Yeah, thanks.
Yeah, and Andrew, we are beginning to see a theme here, right? This is our season 2, and you're our second guest on the show. And You are the second guest on our show that has caught COVID.
Oh, really? Wow.
The first one was actually my brother, and he also caught COVID on the way home from the US, probably in the plane.
Okay.
Probably Omicron variant as well, because that was the variant, the dominant variant in the States when he was coming back. So
I think our next guest may have had it too, but we'll have to ask him.
Okay. Yeah. So really, I mean, listeners or viewers on YouTube, how long are we going to live in fear of COVID, right? I think it's time for us to and this is, I think.
Oh, here comes Dr. Joe Rogan.
Yeah, I think this is the theme that we really do not focus on as much, right? We are talking about vaccines, we're talking about cure, treatment, we're talking about isolation, lockdowns, but Dr. Ian, you being in a government system, right? How often do we actually tell people that the best defense against infectious diseases is to boost up our immune system? Yeah, we don't really talk about that much, right? We as human beings, in very human nature, we are looking for the fast cure, which is the vaccine, the booster, the jabs. These are the ones that are supposed to protect us from all this. I'm not saying don't do all this. You should absolutely get your vaccines. You should actually do whatever necessary protocol.
The fact is, people don't want to hear that they're overweight and don't exercise.
Yeah, absolutely. I mean,
or that they smoke.
Yeah, these are the basics, right? The basics are, have a healthy lifestyle, eat well. Dr. Ian is very fit, right? He's a runner, so and even someone as fit as him still suffers from pretty devastating and lasting symptoms. So
I think that's why I've been more careful about getting COVID, because I'm a bit older than all of you guys.
Age is not something we can control, not a factor we can control, but the rest, whether it's exercising or eating well, I think this is something very important that we should be encouraging people to do. In Malaysia, like almost half the population is overweight or obese. That's worrying, man.
I blame that on fast food from America.
Yeah. Yes, that's definitely a contributing factor. We got to really look into that and eat better and all. Yeah, Dr. Ian, I think it's about time for us to wrap up the show. Do you have anything you would like to share with us? Any encouragement for all our viewers, or maybe introduce a bit about your podcast and how we can catch you and how we can listen to your podcast as well. And just do a quick wrap up.
And we'll have the links below to his podcast.
Yeah, and also our YouTube video links as well. It's all going to be below. All right.
Great. I think as what Dr. Lim has said, I also believe in the same few things. I do realize more and more these days that living moderately is important. So whether it's eating food, and I think there must be a balance, whether it's exercise, whether it's eating correctly, sleeping correctly. I don't know, it's the age talking, or is it because I'm a doctor? I don't know, but definitely I do agree on that point. So for all those who are interested, we do have our podcast on Spotify as well. It's called the Prescription Podcast. It's also on Apple Podcasts as well. You can search, you can look at that. And I think you guys said you provide the links. And there's a wide array of topics. Hopefully we can put up even more for the benefits of everyone. Hopefully our information will be as accurate as possible and non-biased as previously discussed. Yeah.
Okay, yeah. Andrew, you got anything else to add?
No, I'm good. This was a great discussion. I really appreciate you coming on, Dr. Ian.
All right, thanks for having me.
Yeah, this is definitely not the last episode we're going to be doing together, because there are still many more topics that we can discuss and talk about.
Sure, man.
And we haven't even really talked about your journey as an educator. And I know that education is something that you're very passionate about as well. So definitely we're going to have you come back for a future episode, and we're going to have more topics to talk about. But meanwhile, thank you so much for spending your time. I know you're a busy guy. Surgeons are always very busy, as you were talking about just now. And I really want to wish you all the best in Taiwan. When are you leaving for Taiwan again?
If all goes right, somewhere mid-March, perhaps.
That's very soon already. And your family will be following you there as well?
Hopefully, if Taiwan allows it.
Right. Yeah. So really, we'll be praying for you. Be safe and take care. But you have already had COVID, so you are super immune now with the boosters and all. So,
hopefully.
Yeah. So safe journey, and really thank you for your time. So to all our viewers and listeners out there, if you're interested to follow Dr. Ian and his partner, co-hosts, the links are all down below. Our YouTube video links are also down below as well. So do check us out on YouTube if you're listening to this on Spotify or any places that you get your podcast from. Thank you very much for staying with us until the end. Really appreciate all your support all this while. This has been the Doctorpreneurs Podcast, and I'm Dr. Lim together with my co-host, Mr. Andrew Mastrian-Donas. We'll see you in 2 weeks.
Thank
Take
you.
care.
Out.
Thanks.
See you. Bye.
Bye.